somewhere?
Okay.
Perfect. Okay, again, welcome everybody. My name is Athena Bex. I am the HR consultant. And as you see, we are going to be recording this. So you just have to acknowledge that button on your screen. I don't want to do all the talking today, so feel free to ask questions. You can use the chat. If you would like to verbally ask questions, which we do encourage, and sometimes if we don't understand the question in the chat, then we will ask you to speak aloud and ask the question. But every few slides, I will stop and take a break just to see what questions we do have and answer those questions. So the purpose of today's training is to provide you with an overview of what effective injury management looks like. So who's involved in managing injuries? Is it just BBSI? Is it just the insurance company? Is it just you? So we'll talk about our involvement and what steps to take once you do have an employee who claims that he was injured on the job. Also, what proactive measures should be taken to ensure that we're notified of these injuries, as well as programs to help us effectively manage these injuries and workers' comp claims. So let's get started. If you can put it in presentation view, Lyle.
Is it in presentation? I have it on my screen.
Oh, no, we just see the slides, like all of the slides. Only because it makes each slide bigger.
Okay, hang on.
Well, no problem. If you can go to the second slide, please. Just click on slide number 2.
Oh, I see it here. Okay, is that better?
We're just still seeing the same screen.
Oh, I'm sorry.
Oh, it's okay. Yep, there you go. Click on that. Okay, so first of all, let's talk about what equals success in managing a work. There you go. Wow, thank you. And effectively managing a workers' comp claim. Actually, go back one slide. So there's a lot of people involved in order to make this successful. So it's not just you. You're not all alone. You've got other people in your corner, but everybody has roles and responsibilities. So starting with you guys, the employer, you guys are the ones who are going to educate your managers and your supervisors and your employees about their role in, one, maintaining a safe work environment. That's the proactive piece, right? Preventing injuries from happening to begin with, but what to do when an injury does occur. So employees are going to have to report it. Managers and supervisors are going to know how to respond. Offering a return to work modified duty program, which we'll talk about later in these slides, is extremely important. Ensuring that you are consistently communicating with your injured workers about their injury, following up on their medical appointments, reviewing work status reports, and then ensuring that your employee knows what their expectation is when they're injured. So they play a role in this as well. One, they need to report the injury to you. So that would require you guys having a injury reporting policy, which just by looking at your guys' companies where you work, I think most of you guys do, but ensuring your employees know about that policy and how they're supposed to report an injury. Also, ensuring that your employees know that they have to attend all of their medical appointments. That is a requirement. If they're unable to attend an appointment for any particular reason, they would need to immediately reschedule that appointment. Ensuring that your employees know that they have to provide you with a work status report. This is one that we're seeing quite often, where employers just really aren't holding employees accountable for attending appointments or giving them their work status report. That work status report really affects a lot. It affects whether or not they can continue working and what capacity they could work, whether or not money is owed to them. So it's really important that you guys get a copy of it. And it really is the employee's responsibility to provide you with that immediately following each medical visit. And then just ensure that there's a two-way communication. The employee's not left on an island all by themselves, just dealing with their own injury. You guys should be involved, whether it's HR, if it's their direct supervisor or manager, if it's, the person who oversees your guys's safety. But definitely there should be an identified person who is working with the injured worker throughout their claim. Now, BBSI, what is our role play? So we're here to educate you. So right now, proactively, we're talking about what you would do in the event an employee is injured. We're here to help facilitate information between our TPA, Corvell, as well as you guys, making sure that each party has the information that they need. We're also here to provide just ongoing training for you. And with every injury, we want to make sure that you guys have a plan of action so that you guys understand whether or not there's any restrictions, what type of job to provide for them if you have a return to work modified duty program in place. And then just to make sure that, the claim is running smoothly. Corvell, they are the TPA. A TPA is a third-party administrator. So they're not the insurance carrier. We hire Corvell to manage the workers' comp claims. So they ensure compliance on the state side. They are also the one who is engaging and communicating directly with your injured worker. So BBSI typically does not talk to injured workers. We talk to you, we talk to Corvell. And only in rare circumstances would we talk to an injured worker. All communication is expected to flow from you to them as well as Corvell to them. Corvell will also make sure that wages are paid, whether it be salary continuation or it be TTD payments if an employee is eligible for that. So us working together, ensuring we understand our roles, will make sure that we have success when managing these workers' comp claims. Next slide. Okay, first of all, there's a lot that you guys need to do on the preventative side. Having different policies in place within your IIPP and having specific trainings in place. But today I'm only going to focus on a couple. One is having an injury reporting policy. So that sounds pretty standard, right? And it really is. But often we throw policies in a handbook and they don't get discussed. So maybe they get read by the employee when they get hired and then signed off on, maybe they don't. But it is important that you guys have a written policy, and your policy should outline, why it's important to report an injury, when employees need to report an injury, how to report it, the consequences of not reporting it, and then some sort of acknowledgement that the employee did receive a copy or understands what the expectation is in reporting an injury. So that would be like just a standard acknowledgement form. So a reporting policy would look something like, an employee's injured within 24 hours or within a couple of hours, they have to report their injury to the safety manager. And they would do so verbally, as well as providing a written document outlining the injury. And if they don't report it timely, there could be disciplinary action. So the reason why that's important is because all of you guys need to know when an employee is injured. And it's not to have a policy to, basically discipline them because they were injured. The purpose is that you guys have a policy so that you can act on it right away, regardless if the injury turns into a workers' comp claim. You guys need to understand what happened and then try to do a root cause analysis to identify how it happened and prevent it from happening again. It's just part of your safety measures and part of keeping a safe work environment. Also, in the event that the employee does want to file a workers' comp claim, we're able to act on that claim a lot quicker if they're reporting it timely. Now, second, having a return to work mod duty program. How many of you guys have one? If you do, click on that little hand raising button, just so you guys know, just so I can see how many of you guys have one out there. And having one could be an unwritten one. You just know, hey, if our employees are injured, we're going to make sure that we find a modified duty job if they're on mod duty. Others, it could be an actual written return to work mod duty program, which is nice to have it in writing as well. Well, Having a return to work mod duty program is important for many reasons. First, for the employee. I mean, knowing that if they're injured on the work and they can't work the job that they are hired to do, or they can't complete all of the duties, then they know that there's still a job available for them in some capacity. So just knowing that my employee cares about me and is willing to provide alternate work for me if I'm injured is a great feeling. Second, it helps reduce costs of a workers' comp claim significantly. And I think most of you guys know that if you've had an injured worker. Most of my clients, it's just not even a question. Mod duty will always be accommodated because they do understand the benefits on all sides, on the employee side, as well as, bringing down the cost of claims, bringing down an X mod as well, keeping costs down. And second, or last, I should say, having an employee return to work right away, it's proven, statistics show that they're more likely to return to work full duty. One, they're away from their house. They're not getting too used to just sitting around collecting a paycheck. They're able to come back to work, be around others. I mean, especially right now during this pandemic, the more that we isolate ourselves, for some of us, the worst state of mind we could be in. So being around other people really just keeps us going. And we have a little bit more control over their activities during the daytime, and so that we can see what they're doing, ensuring that they're not violating any of their work restrictions. Whereas if they're at home, we really don't have visibility into that. Okay, next slide. So when you have an injury, what are you supposed to do? I think that is why you're here today. What am I supposed to do? There's forms. I know there's doctor's appointments, there's mod duty, there's disability pay, salary continuation. Sometimes they get attorneys. What is my job in all this? What can I do? What can I do? It can be pretty overwhelming. As you see, Sally, the manager over there, it's like, oh my gosh, on top of everything else I have to do, now I have to manage this injury. So again, being proactive, ensuring that you understand your role, your employee's role, that's step number one. Next slide. So when an employee is injured, they're going to need medical treatment, right? So it's important to understand what type of treatment they're eligible for, what type of treatment you can allow or they could choose. So some injuries are mild. Like I mentioned earlier, that it's important that all injuries are reported. Just because it's reported does not mean that you automatically set up a workers' comp claim. There's discussion involved. You get with your injured worker, you ask them how they're feeling. Do they feel like they need medical treatment? Do you feel like you need to be seen by a doctor? In some situations, employees don't. They're like, hey, I'm in a little bit of pain, but I think I might be okay. Well, it's always best that, if it's something that you can just treat with your first aid kit right there in your office or in your truck, great. I mean, that's pretty minor, a minor cut, perhaps, a little burn, maybe a splinter. So if it's something that is, a little bit more, next level medical, and they're just not like wanting to be, sometimes they think they might be a wimp by going into the doctor, but they feel like they might need some guidance. That would be the perfect opportunity to call the first aid 24/7 triage nurse that BBSI has. And you can call the nurse for either to create a claim, to get a doctor's visit, or to just get self-guidance, self-care guidance from the nurse. So it's an actual medical professional. It's a nurse that answers the line and that your injured workers would speak to. And sometimes it's just a little bit more comforting knowing that, you're in pain, but knowing whether or not you should ice, or you should put heat, or you should use an anti-inflammatory, what kind. So they have the opportunity to speak to a health professional to get that information. Or they can choose to actually be seen by a doctor. The minute they're seen by a doctor, that is what's going to initiate a workers' comp claim. Last, if it's a true emergency, somebody is unconscious, blood's gushing, a body part is missing, call 911. I mean, don't even try to determine whether or not, you should call the triage nurse. No, you need to call 911. Your instinct kicks in when there is a true emergency. So the remainder of this presentation, we're going to focus on an employee who actually wants to seek medical care and what that looks like. So step one, your employee comes to you, they tell you that they're injured. You guys talk about the treatment options. They want to see a doctor. The first thing that needs to be done is they need to, well, after reporting it to you, they need to call the BBSI's triage nurse. That number is located within the claim packet, which we call the red folder. You guys may refer to it also as the red folder. So they can call the triage nurse. They are bilingual, so they speak English and they speak Spanish. The nurse is going to do an intake. So they're going to ask your injured worker a variety of questions. Sometimes this can be a little, I know some of our clients say it's kind of a long process, but it's an important process. I mean, they're asking a lot of important questions and they're reporting on the answers. They provide an actual intake report that gets sent to us that we can forward to you guys. The nurse will also ask them where they're located and identify a doctor that's either close to their home or close to the workplace, whichever they prefer, or whichever you prefer. If you prefer that treatment is close to your workplace, make sure you notify BBSI about that so that we could write that into your account protocol that the nurses have access to. So they'll identify the clinic, ensuring that it's in our network. They will authorize the visit. And they'll provide the employee with instructions. They'll pull on how to get there with the address. They'll provide them with a first and temporary prescription refill card in the event that they are prescribed a medication at their first visit, because then the claim would be in the process of getting set up. We don't want to delay their medication, so they'll have a temporary prescription card for one fill. And then they'll also create the claim on the back end. So utilizing the triage nurse really drives the process forward, along the claim process forward. And it saves you guys time too. You're not having to figure out which clinic to send them to, having to call the doctors, be put on hold to verify the treatment and provide authorization. Next slide, please. Okay, so the injured workers called the triage nurse. They've reported the injury to you. Now they need to actually seek medical treatment. It is advised that they seek medical treatment immediately. So right after they call the triage nurse, they should head over to the clinic to get the treatment. Now, whether or not they have a post-injury drug test is really dependent on a lot of factors. And that's something that you should definitely talk to your risk consultant and your HR consultant about, that, because it could be specific to industry, as well as just internal protocol for you. But that is one thing that if it's set up for your guys' account, that is one thing that would happen is the post-injury drug and alcohol screen would be administered at the time of visit. Now, how does the employee get to this appointment? They could drive themselves. We recommend that they partner with somebody at the job site. So whether it be their supervisor or lead, but we recommend somebody drive them to the medical appointment. They're there to comfort them. They're there to drive them back. I mean, if they're totally hurt, they may not be in a condition to drive, or they may be a little shooken up depending on the severity of the injury. But it's just somebody there to ensure that they get there safely and just to kind of be a support system. Now, immediately following the appointment, as I mentioned earlier, it should just be like drilled into your employee's head that they have to provide you guys with a work status report. Again, I see it way too often where I'll check in with you guys and say, hey, so what's the employee's work status? He had his first visit. And it's like, oh, I don't know. I never got a copy of the report. And it was a couple days later. And it's like, whoa, he was put on modified duty and you guys didn't know about this. BBSI is the last person to get a work status report. So the work status report, first and foremost, goes to the employee and the doctor's intention. And the doctors should be requesting that they provide that their manager or human resources or whoever the designated person is at the employer site with a copy of the work status. So if your employee is not returning back to the work site after their appointments, then they should be told that they have to take a photo of it or send it via email. so that you guys have a copy, and they should be required to speak to you or check in with somebody before reporting back to work, just to ensure that one, just to be able to check in with them and follow up with them on their work, on their medical visit. Second, to review the work status report together. And if there's modified duty, ensure that a modified duty job is identified and offered to the injured worker. Okay, let's talk about that medical or that work status report. So the work status report, really, it's a document that identifies the date of their appointment, the date of their injury, a diagnosis of what the injury is, who the doctor is that's treating them, whether or not there's any type of referrals that are involved for treatment. So if they're going to be referred to physical therapy, if they're going to be referred to chiropractic care, if they're going to be referred to a specialist. There's also information on their work status. So that is the most important thing you want to see, but you want to make sure you're looking at all of the information, so you have a good idea of the direction that their medical care is going in. And the work status report will identify whether or not mod duty is being required. If so, it will list out their restrictions. So something common, especially we see for, back injuries. So an employee is on modified duty, they're not able to push, lift, pull more than 20 pounds. Must be able to take breaks and sit as needed. So that would be like a common work status that a doctor would give. Finally, the doctor is going to identify when their next appointment is, and then sign off on that medical report. So let's see if there are any questions. Okay, we've got one question in the chat. Is there a way to get a schedule from the injured worker? Yes, absolutely, and I would encourage it. If they're scheduling out their appointments ahead of time, which they should be, and sometimes depending on the clinic, I'm not sure how far they could go, but definitely at a minimum, one appointment out. If they have physical therapy or chiropractic care, then that would be something that they could schedule out in advance, all of their visits, which typically is approved, 2 to 4 weeks at a time. And those could all be scheduled in advance, and they would get a copy of once it's scheduled of the ongoing schedule that they could provide you with. So just make sure you guys are asking them for that information. Okay, if it's verbal, do we accept it? Make a note of it and ask them to provide you with written confirmation, so they can call their doctor back and they can get you a copy. Their next appointment should always be on the work status report. So as long as they're giving you the work status report, you should at a minimum know the next appointment. But as I mentioned, where the doctor's visits are scheduled way in advance, whether it just be your regular check-ins or physical therapy, chiro, anything like that, the doctor will always be able to provide confirmation of that. So there's no reason why it can't be provided to you in writing. If your employee isn't getting it, or they're just not sure, or they don't feel comfortable calling back, I would suggest helping them, and you guys can get together and call the doctor together and ask for them to email or fax you a copy of that form. Any other questions so far? Injured worker reports the injury, goes to their first medical appointment, returns back to work with a work status report. You guys are reviewing it together. Now, this is the first step in injury management and injury care. Your behavior is really going to drive the direction of this claim. So put yourself in an injured worker's position if any of you guys have been injured. Knowing how your employer is reacting, what their emotions are. If somebody's mad at you because you got injured, like sure, as an accident, probably not a really good feeling on your end. Or if they're frustrated because now you can't work full duty and they really need you, doesn't make you feel too good. So just make sure that you guys are always being empathetic. You guys are being supportive. Checking in with them shows that you care. It also just ensures that your employees doing what they're supposed to be doing by going to the doctors. and that this claim isn't spiraling downhill, because the claims that I see that go downhill are because the employers are not involved. It's the employee who is getting treatment when they want to, not going to all their appointments. How are they going to get better if they're not going to all their appointments? The doctors want to see them and they want to evaluate over time that they're getting better. And the claim is going to stay open. So in order to get this claim closed, we want to make sure that there's activity going on and the employee's getting treated. Okay, I see one more question come up. What if they refuse medical attention? Great question. So as I mentioned at the very beginning, there's a few different options. When an employee is injured, you always want them to report it to you. And sometimes employees don't want to report it because they don't feel like it's a big deal and they just don't want to go to a doctor. And that's fine. They don't have to go to a doctor. It's their choice. But when they choose to, you have to report it. So we do have what's called the yellow packet to document injuries that occur, but when an injured worker does not want to seek medical attention. So that's certain documentation that you would want to make sure you have. And I'm going to go over that at the very end of this presentation. So we'll circle back around to that. And you'll see here shortly exactly what paperwork to give them. Okay, next slide, please. Okay, so the injured worker goes to the doctor. That is a perfect time for them to complete that long, annoying packet. So I'm sure you guys have seen a copy of it, which I'll open up here shortly. But essentially, as if your employee is injured, you are required as an employer to provide them with medical care and within 24 hours. And so that is basically, proving allowing them to file a workers' comp claim. So the true proof of that is the actual DWC-1 form, which is a state form that has to be in every injury packet. BBSI has customized the packets that we've given you. So there are only a couple of required forms on the state level, although we do require some of our forms to be filled out. But that is the one form that is an absolute must that every employer in California has to provide their employee with. So it's within 24 hours. The best time for your employee to complete those documents are when they're waiting at the doctor's office, because we all know how those occupational clinics are. You can be sitting in that chair in the waiting room for 30, 40 minutes, sometimes even longer. Then you get put in an office, you're there for another 30, 40 minutes. So it really is a perfect opportunity for them to start filling out the forms. It's suggested that you guys always have packets available. BBSI, we no longer are providing hard copies of the forms. We do have them all online for you guys to print, but you guys could print your own, distribute them to your supervisors. If you guys have various job sites, ensure that there's a couple of packets within a truck at all times so that your employees have access to it. We have some of our clients who have now loaded the documents into like a DocuSign so that your employees could fill out the forms, right on from their phone when they're in the waiting room and just electronically sign everything. So that's an option as well. Okay, let's take a look at these forms. I'm not going to go over them in full detail, but just want to give you guys an overview, quick overview, so that you're familiar with what these forms are. Can you click on the first link file, please?
Can you see it?
No.
Yeah, I see the red folder showing up.
Okay, we can't see it.
Okay.
Is it
Here, hang on.
There we go. Okay, if you can just scroll down to the second page. So this is exactly what the red folder looks like. The very first page are the employee instructions. So if you guys have not gone through this packet, I'm going to suggest that you guys do, give you guys some homework. Just sit down and read through it. Read the instructions so that you know exactly what your employees are being instructed to do. If you have questions, then bring them to our attention. If there's other steps that you want to require of the employee, you guys can absolutely customize this, and you guys can put your own instructions on the cover page. Get with your HR consultant and risk consultant, and we can help you guys customize this if you need to do so. But essentially, this is telling your employees what to do. This packet does come in English and Spanish. If you guys have any of our old packets that we provided you with, it's double-sided. So one page is English, one side is English, one side is Spanish. And but yeah, ensuring that you guys follow the instructions. One thing that I want to point out is very common. If your employee is rushed to, or I should say, if your employee chooses to go to the ER because they're in a lot of pain and it's after hours and the clinics are closed, or they just feel like it's a severe enough injury that requires emergency attention, make sure that when they return, they provide you with all of the medical notes that they were discharged with, as well as having a conversation with them to understand how that medical bill is going to be handled. So 100% of the time when they go to an ER, the ER bills the employer, or the ER bills the injured worker directly. So they really don't take the time to deal with workers' comp information. I mean, they're an emergency center. They're trying to get people in to get cared for. So they just do an intake of the employee's information and bill them. So it's important that the employee knows that they have to respond to the provider and let them know that it's a workers' comp injury. On this form, at the bottom of the form, the information is on there as to where it can get billed. Chances are your employees aren't going to remember this, but if they can do it when they actually go into an ER and provide them with that information, it will save time in the future from them having to deal with medical invoices. But if not, if they ever get a medical invoice, that's what they're supposed to do. And if you guys feel more comfortable calling on their behalf and providing, just as the employer, to confirm that it was a work-related injury and provide them with the billing information, you guys can do that as well. We can also do it. It's a longer process for us to do. And so it really expedites the process if the injured worker does it first, or if you guys do it. But so you guys do know, if there was an injury that was work related, and it's a claim that's accepted, it is illegal for a provider to bill the injured worker for that. So oftentimes in these situations we see, and I'm not sure if you guys have experienced this before, but when the injured worker receives a medical bill from the ER, they get multiple, they give you a copy and say, hey, pay this bill. And then before you know it, they're getting threats from their collections department saying they're going to, take them to collections and, it's going to affect their credit. That won't happen. And if it ever did happen, it would get reversed right away, because there's actual a workers' comp code out there that states that it is illegal for a provider to bill an injured worker. So that would never hold up. Okay. And if you just slowly scroll through the packet, Lyle, so there are quite a few pages. This is the DWC one, very first. This is the one that I talked about, the state form. This is acknowledgement that an employer offered medical care and that an employee is choosing to take advantage of it. As mentioned, you have to give this to the employee within 24 hours. Well, they are going to then be required to turn that around to you within 24 hours. Now within, I think it is 3 days, the employer has to fill out that bottom section. So it's the employer section. So there is a time limit on all of this. So that is with actually it's within 24 hours from your employee submitting this document back to you. You have to complete that bottom section. So whether it's you guys doing it, or if it's your HR department or office manager department, whoever oversees human resources, that absolutely has to be filled out by a certain time frame. Now, the rest of the forms are just intake forms. So this is a report of injury and illness, all the information that we want to know, the information that the adjuster needs to know. Then the following page is the medical provider network acknowledgement form. So we are in a medical provider network here. With BBSI, that means that unless an employee pre-authorizes their own medical provider, which we don't want them to do, we just want to ensure that we have a provider who's been vetted and knows how to handle the workers' comp injuries and just knows the laws behind it. But unless one is pre-authorized, then an employee has the option to choose a doctor from, oh gosh, so many doctors, but it has to be somebody that's in our network. And as I mentioned, there's hundreds of doctors, many more than that in our network. Last is authorization to release medical records. And a clinic is not just going to release medical records to anyone. They're going to want to ensure that the employee is authorizing the release of those records due to HIPAA laws. So that form is important as well. And there's one more form if you scroll down, Lyle. And oh, is that the last one? Okay, so that is it for from the employee forms. So we can close out of that, go back to the slides. And then I did include one more link, which we're not going to look at, but in addition to those forms, then there's handouts that you have to give the employee. And that's just information on our medical provider network, as well as the instructions for the DWC one, just advising employees of their rights and instructions on how to fill out that initial form. And this is it right here. So again, these are forms that are just required to be given to the injured worker. They're informational. There's nothing for them to sign. So no need to scroll through all of it. Okay, next slide. So the employee has their portion of forms to complete. You have your portion of forms to complete as a supervisor. And those forms need to be included in your packet that you send to BBSI. So you're going to want to include the employee's completed forms as well as your forms. And similar to the employee packet, we provide you guys with instructions. We give you guys the number to the triage nurse, just like the employee has it as well. We tell you what the turnaround time is. We want these back within 24 hours. We do realize that sometimes that's impossible. So 24 hours or when practical, but definitely it is urgent that you guys get these to us because we have to get these up to our adjuster. And so the claim is kind of being put on hold until they have these forms, because then they have the authorization to reach out to the clinics to get reports, as well as they have more information about the claim. And then they call your injured workers to just assess them, confirm some of the information, obtain other information, and just give them just information about, what the next month looks like, 2 months, 3 months, and answer any questions that your injured worker has. So the supervisor's report of injury and illness, this is a form that's going to be talked a lot about from our risk team, because this is really important. This is the equivalent of an accident investigation form. So in terms of really digging into how an injury occurred and how you guys can prevent it from occurring again, and whether or not trainings are needed, our risk team is going to be looking at this form in depth. And one thing that I always advise is don't just copy what your injured worker puts down on their report of injury, because the questions are pretty similar, but put down the information that because if it doesn't align to what your injured worker is saying, we'll ask questions about that. And sometimes it's maybe you did put the wrong information. Other times it's because no, as you know it, this is what happened. And if it doesn't align to what your injured worker says, that could be a red flag right there. Okay, next form. Witness statement. It is extremely important that if there are any witnesses that we get their statement, because we want information, as to what they saw happen. If there are no witnesses, then you wouldn't complete this form, or nobody would complete this form. Next page. Okay, injured employee modified work offer. This form is only to be completed if your injured worker is actually on modified duty. So we suggest that you always keep copies of this form. You can just take this page and photocopy it. But every time your employee is on modified duty, you want to fill this out. If your employee's restrictions change, they're still on modified duty, but the restrictions, perhaps they have more restrictions placed on them, then you would want to address it again and provide them with a modified duty work offer. So the reason why we ask you to to present this to your employee and have them sign off on it is because, you know, you guys have a return to work modified duty program. And if you don't already, hopefully you guys will soon. And if you guys offer them work and they choose not to accept it, that's on the employee. They would actually be disqualified from any type of wage benefits, so salary continuation or temporary disability benefits, if they choose not to accept a modified duty offer. That is one way of controlling costs, as we mentioned earlier, having a modified duty program so that you don't incur disability benefits, which is known as indemnity costs. So this is proof, though, that you did offer your job, you offered your employee modified work. So as you guys know, supervisors, you know, if it's not in writing, it didn't happen. So verbal is fine. However, verbal will not hold up in court unless it's recorded. Okay. So your guys' job is to complete your portion of the forms and take the accident investigation seriously. Fill out the report, talk to your witnesses, take pictures of any photos, or excuse me, take photos of the accident, whether it be equipment, the employee's wound, if they allow you to take a photo. If there's any equipment that was faulty and you think that may be why the injury occurred, let us know, because we could then go after that third party. So if it was a ladder that, you know, perhaps is new and something was wrong with it, we want to know about it. If it was a motor vehicle accident and it was the employee, or I should say the employee was not at fault, they were hit by somebody else, you guys should have a reporting process separate for motor vehicle accidents, and obtaining the insurance of the other party should be a requirement, as well as notifying the police so that there's a police report. So that information would need to be sent to us so that we could subrogate the claim. We could then go after the third party to pay for some of the expenses, a good portion of them, which would then reduce the cost of the claim as well. Now send all completed forms to us. I think you guys know where to send them to. It's actually on the next slide, I believe. If you could click on the next slide. So San Jose Injuries at bbsihq.com, and you always want to ensure that you copy your HRC as well as your risk manager. If you're not sure who your HRC or risk manager is, I think all of you guys should know, then please reach out to your BBSI contact, or you guys can shoot me a message and I could find out for you. Okay, next slide. So supervisor monitors work status reports. We talked about this earlier. To remind you, this is not just the first appointment. This is every appointment. So what does this look like? This is part of middle management of this workers' comp claim. This is important because it ensures that you guys are aware of what's going on with this injury. You know, you can ask your employee, hey, are you feeling better? What does your doctor say? Then you'll want to make sure the work status report reflects that when you're looking at the work status report, that their injury, they're progressing. If your injured worker is telling you they're feeling better, but the work status report doesn't reflect that, there's a disconnect there. And that's a red flag. And that's something that you would want to bring to our attention. We would advise that you call your physician. That would be the injured worker's physician. And I've had clients say, well, are we allowed to? Like, isn't there privacy laws and we can't talk to the doctors? You can absolutely talk to doctors. You just can't drill down to their medical condition as well as medical history. So it's going to be more talking about their treatment, their modified work, whether or not they're progressing. If you guys have any concerns, you can bring those up. I just met with a client yesterday who had concerns, and they had an injured worker who was complaining, who they offered modified duty to, was complaining about the work that they were doing because, you know, the guy was a tow truck driver and he was now doing office work, and that's just not what he's used to. And he was bored to tears, and it wasn't enjoyable. So he wasn't showing up all the time to work. He was saying that he was in pain. And next thing you know, the doctor is releasing him back to full duty. And it's my client called me and said, so, I'm a little concerned because this guy is like legitimately in pain, and I don't know if he should be going back to work full duty because it's going to prevent him from getting better. There's going to be more weight placed on his foot, etc. So I advised that he called the doctor, and he didn't really know what to say. So I guided him through that. We called the doctor together and asked the doctor, or explained to the doctor what our concerns were, and wanted to know was whether or not the injured worker was communicating that he was still in pain. So it gets us all on the same page. And this is always, in order to really just provide the best for our injured worker. Now, sometimes it's opposite reasons, unfortunately, that we're calling the doctor. It's because there's just too many red flags on our end. We have concerns, and we want to make sure the doctor's aware of them as well. And that's completely fine to do, to be able to call your doctor stating that you have concerns. I've even told on my injured worker before, and he wasn't wearing his boot, and called the doctor and said, hey, he's not following instructions. Like, he's not wearing his boot, so that hopefully the doctor can knock some sense into him. So we call this care contact, checking in with your injured worker regularly, holding them accountable. I'm a fan of taking their medical appointments, just like, whoever it was that asked earlier about whether or not you can have a list of all of their future appointments. Absolutely. Putting it into your calendar and checking in with the employee. Say, hey, you have a medical appointment coming up. Make sure you talk to me afterwards on that day. Hey, you had a medical appointment. Where's your work status report? If they're not giving it to you. Sometimes you'll find out that they didn't show up. So it's like, okay, hey, you need to rebook that appointment. Let me know tomorrow what time that's rebooked for. And then also just checking in with them on how modified duty is going. Hey, do you feel like this is helping you? Are you progressing? Do you have any ideas of other jobs as well, modified duty jobs that you feel could be a benefit for the company, as well as ensure that, you're not working outside of your job duties that the doctor's currently allowing. Setting the expectations with your injured worker, as we mentioned at the very beginning, everybody has a role. So making sure your injured worker knows what their role is important from day one. So making sure they know that, hey, they have to schedule appointments. They have to attend their appointments. They have to tell you when their appointments are. They have to give you a work status report immediately following every appointment. If you guys have a return to work mod duty program, which you guys should, the job may change. The expectations of that worker does not change. Regardless of any of your jobs that you guys offer, you guys expect everybody to show up on time. I'm sure there's a reporting procedure that you guys have in place if somebody's going to be tardy or if somebody's going to be absent. You expect employees to work hard, to perform high. If they're having any issues getting the job done, that they're talking to you. Those expectations do not change for modified duty jobs. And the most common phone calls I get from clients when an employee's on mod duty is that they're not showing up on time. They're not showing up at all. They're not even calling. They're complaining about the work. They're doing, pardon my language, a half-assed job. And that's not acceptable, because again, we're treating these employees the same and holding the same expectations as we would to somebody else. If they're not able to do the job because it's hurting them or because it is outside of their restrictions, then okay, we need to do it. We need to do a job check and confirm that this job is within the expectations. If there's somebody else asking them to work outside the expectations, that's a no-no. We need to make sure that we address that immediately. Anytime you get a work status report, go ahead and send it to your HRC and your risk manager when you have questions. And we, like I said, we don't get the work status reports. You guys would get them sooner than us. We do try to do periodic checks on the claims, but really we're getting our information from you first. So we're always going to be partnering with you at the very beginning of every claim to check in with you, especially if it's the first time you're dealing with a claim. Like we know your company's never had one, at least not one while you guys have been partnered with us. We'll ensure that you guys have a good plan of action. The minute you see a claim going sideways, it's like, whoa, this guy's like not really listening to us. He's not going to his appointments. Like it doesn't seem to be getting better. Like he does not want to work. He just wants to be at home. Call us so that we can talk about this and figure out what's going on and try to get this claim back on track. Does anybody have any questions so far? Okay, I don't see any questions in the chat. Next. Thank you. Okay, there are definitely triggers and times when you need to alert us right away, because this could really change the direction of your claim. And we want to make sure that we are addressing it right away, that you're addressing it, that Corvell is addressing it. And so we're kind of, again, that middle person. We help strategize here. We send information along to Corvell. So when you guys have a very serious injury, again, unconsciousness, a body limb, maybe a missing, death, anything that requires, well, besides death, your employee to be hospitalized is significant, and you have to notify BBSI. Like, that is a 911 notification to us, even if it's off hours. You should have everybody's cell phone on the team, and you can send one team alert to all of us. And one of us, even if it's on the weekend, one of us will be able to get back to you guys to help you just navigate through it. This doesn't happen often, and hopefully it will never happen again to any of you guys. But if it does, if your employee's hospitalized, there's certain things that you have to do, and notifying OSHA may be one of them within a certain time frame as well. And there could be huge fines if you don't. Next, if your injured worker is ever placed off of work, so that means not them placing themselves off because they just don't feel like coming into work. You know, they think they have a workers' comp claim and they don't even have to come into work. They are wrong. But if the doctor puts them out of work totally, so that would be it's called TTD, temporary total disability. The work status will say completely off of work until, and they'll have an end date. When you see that on a work status report, obviously that's your employee's required to stay home. You need to notify BBSI, and we need to talk about what that looks like, whether or not you guys are going to be continuing their salary or if Corvell is going to continue it. When Corvell pays disability, it's paid at 2/3 the employee's average weekly wage, which is basically a calculation that goes back 1 year from the date of injury. That includes all their bonuses. It includes commissions, all types of pay. And it's paid at 2/3 their rate. That turns into an indemnity claim. And indemnity claims are what hurt your guys' ex-mod. So we want to be strategic, and we want to have a plan put in place, and to ensure, how we're going to get that injured worker back to work, modified at least, and whether or not wages are going to be paid by you or Corvell. Some of you guys do have policies that you guys pick up those salary continuation wages, but it's definitely a discussion to be had with your BBSI team. Okay, if you guys have an injured worker, it's medical only, maybe the employee has never been on mod duty or he has been on mod duty, and it's already been a couple of months, and you're noticing that he's still going to appointments, still going to therapy, and it doesn't really show that he's progressing that much. Bring that up to our attention, because that's when our adjuster could address whether or not where his medical treatment is going. Like, is what you're doing working? Because it doesn't seem like it is. Like, what is your plan to get this person better? So we'll make sure that the adjuster gets in contact with the doctor. So again, you guys have access to this information before Corvell and I do. So it's really important that you guys keep your eye on this. A medical only claim, for somebody maybe that has a back strain or a sprain, that it really shouldn't be open for more than a few months, couple of months, really, as long as they're following doctor's orders and there's nothing significant in an MRI or they have to be referred to a specialist. Okay, you guys notice on the doctor's report that they are being referred to a specialist. Let us know right away, again, because that means that there's a change in the direction of their healthcare, and it could be a little bit more significant than we had thought. So the doctor's saying, we're noticing, something in the X-ray or an MRI, and now we need a specialist's attention on it. We really want to gauge where that medical treatment is going and estimate how long we believe the claim will be open for. If your injured worker is scheduled to have a surgery, let us know. You'll see that on the work status report. This is also information that your injured worker should be making you guys aware of as well. So we want to make sure we have a plan of action. Also, anytime your employees are referred out to a specialist or to get surgery, that goes through an approval process within the workers' comp system. Sometimes that gets held up. And when it gets held up, that holds up your claim. So when you see that they're referred to anything except for chiro or physical therapy, make sure you follow up with your injured worker within a week to find out if it's been approved and if they've scheduled the appointment. If you're hearing from them that they haven't heard, contact BBSI. We'll get with the adjuster and make sure that we get the proper approval, and right away, we'll push that through. When you're checking in with your injured worker, ask them how they're doing. How do you like your doctor? Do you even like your doctor? How do you feel like the treatment is going? Do you feel like you're getting good care? Do you feel like they're listening to you? Do you feel like you're getting better? So an injured worker always has options. If they're not happy with their doctor, they're just not jiving with them, and they don't like the clinic, they don't like anything about their treatment, then they have the opportunity to seek alternate care. And at that point, we would direct them to their adjuster to help them identify another doctor. What we don't want them doing is running to an attorney. How do claims get litigated? Well, one, they don't feel like they're being heard. They don't feel like they have the support from their employer. They don't feel like they have the support from their adjuster. They feel like they don't have the support from their doctor. They just feel confused about everything. And all they've heard is that, oh, when you're injured on the job, get an attorney. They'll tell you everything you need to do. Sure, they'll tell you everything you want to do, but they can also be told everything they want to do for free without having to ultimately pay for an attorney. And so we just want to make sure that their voice is heard, and any hurdle that they have, an obstacle, can definitely be addressed. They just need to ensure that they're communicating that to you guys as well. In the event they do get an attorney, some of your communication may be limited with them. Holding them accountable for doctor's appointments, as well as work status reports, that doesn't change. But the level of how you help them with medical care could be limited. So just make sure you talk to BBSI about that so we can guide you on next steps when they do get an attorney, if they do. Next slide. Okay, and I know, guys, sorry, we're like a couple minutes over time. This was the initial question of what do we do when an employee is injured, but they don't want to fill out or file a claim? No problem. Make sure it's documented. Make sure you still offer them medical care, but they do not fill out the DWC form, because filling it out results into a claim. They just are given a copy and they're told that, hey, no problem. If you change your mind, you can seek medical care. No problem. And there is a link to that form, and we will send these slides out, and the links will be in the slides to all the forms for you guys to download and have access to. They can also be requested from BBSI if you guys need a copy. Just reach out to your HRC, right, which is your HR consultant. And then finally, last slide, questions. So any final questions that you guys may have? I'm more than happy to spend a few more minutes online to take any more questions or any specific situations that you guys have been in or are in and you guys need guidance on. I'm more than happy to help you. Just let me know. Okay, we do have some questions coming through the chat. And let me see. So I addressed it. Yes, you guys will get a copy of these slides. Who contacts OSHA if needed? Great question. You guys can contact OSHA, and BBSI can contact on your behalf if you guys authorize us to do so. My thought is, you guys should be owning this so that you guys can take control of what's going on. But if there's something that you're doing that you don't have experience with or you don't know how to handle, please reach out to us and we'll guide you through it, and we'll do it with you, alongside with you. It's very often that I partner with my clients and we'll call the doctor together. We'll review a work status report together. I'll show them what to look out for. We'll call OSHA together, and it's usually not me. It's our risk manager. They're the ones who have relationships with OSHA and really know how to handle them. So they're best to guide you through that phone call first, and even make the determination whether or not a phone call is warranted. What if it's a small cut? Do these injuries need to be reported as well? Good question. And I don't want to say yes or no, because maybe it's a small cut, but that's because your employee got lucky and it could have been a really, really big gash. So my suggestion is, sure, if they just, got a tiny little splinter, no, but if they got a tiny little splinter on, a piece of wood that was sticking out, that is a safety violation, then yes, they should. So there's some judgment call in that. But my suggestion is, if you're not sure when, just say, hey guys, right now, we want everything reported. And then you, on a case-by-case situation, you'll say, this is reported. And hey guys, let me just use this as an example. We're trying to identify and have you guys learn when things shouldn't be reported. And then you guys could talk about it, as a team. But I would suggest that, everything get reported for the time being, so that you guys are able to just analyze, that injury or that near miss injury as well. Okay, and did I cover all those questions? Okay, that's it for now. Any final questions? Well, we have you guys on the phone. Just make sure that your guys are reaching out to us. We're here for you, and we want to partner with you guys.